Good morning, ladies and gentlemen. Today we are going to look at workplace safety. Remember, last time in occupational health, we introduced occupational health. We looked at the various aspects of occupational health and the roles of various stakeholders in promoting occupational health. We also looked at some of the guidelines that we follow whenever we are promoting occupational health. And today we are going to look at some of the injuries and illnesses that can arise in our workplaces, what we can do to prevent and avert them. But even before that, we shall look at their effects on either our work and our lives, and then shall look at what we can do to prevent them and the roles of some of the key stakeholders in occupational health, and then we shall also look at uh, some of the some of the areas that need our attention in occupational health, and then we shall acquaint ourselves with other aspects of occupational health as far as preventing workplace injuries and illnesses are concerned. So the burden of these illnesses and injuries takes on various dimensions, or the effect of these injuries and illnesses can be majorly of three aspects, and we look at health impact, whereby we acknowledge that these injuries and illnesses can lead to pain, disability, reduced quality of life, and increased mortality or loss of life. Then they can also greatly affect the economic status, whereby you look at the medical expenses that are incurred whenever you're treating people with illnesses and injuries that arise from the workplace. Then sometimes you have to compensate the people that have got those injuries and illnesses. Productivity losses whenever they are absent or you lose them, then productivity, of course, is lost. And then other indirect societal costs. The society loses a valuable member whenever they are ill or they die because of these workplace injuries or illnesses. Then the social impact of these injuries and illnesses include the fact that they affect the individuals, families, and communities from who these individuals come, and then we also acknowledge that they lead to emotional distress in amongst the families and the communities, and then social disruption whenever a family loses a member, whenever a community loses its members due to these workplace injuries, then there is that social disruption. It is no longer the same. But like we said, we are going to look at the roles of stakeholders in the management and promotion of workplace safety. So leaders in this case can include the employers, the human resource managers, the general managers themselves, and even as public health professionals. We also have a leadership role to play, and the skills that can contribute to improving the workplace safety and averting these injuries and illnesses include setting a clear vision and goals for safety. You should be having a goal that you want to arrive at whenever you're promoting these activities. Yeah, it could be averting maybe uh, illnesses among uh, among employees of a certain company during such a period of time. Yeah. could be illnesses arising from physical inactivity or any other exposure. So if it is physical inactivity, then you're going to make sure that you implement those activities that promote physical activity. Yeah. So again, apart from setting a clear vision and goals for safety, you communicate safety expectations. What are the workers or the employees expected to do in order to achieve those goals? And then you make sure that they gain that culture of safety. Should be a culture, or they develop those behaviors that promote this safety at the workplace. Then it is also essential to provide the necessary resources which will empower these employees and workers to adhere to these safety measures. Yeah. Then apart from doing all that, you should make sure that you lead by example and actively participate in those safety activities. So it doesn't make sense if you tell the workers that they should engage in safety activities when for you yourself you are not taking part in those safety activities. So you make sure that you lead by example and participate in those safety activities. Then another skill that you need is to empower employees to take ownership of the safety. So here, you also make sure that you educate the employees, you make sure that they gain the knowledge about safety and its importance, and then provide the necessary resources. And by doing this, you'll be empowering the employees to take ownership of safety and participate in these safety activities. So, as a leader, you must set a clear vision and goal for safety, must communicate very well the expectations for safety, must provide the resources necessary for these safety initiatives. You have to also take part in those safety activities, thereby leading by example, and also are obliged to empower your employees or your colleagues to take part in ownership of safety. So empowerment of these workers will will make these employees to participate actively in safety programs, to report the hazards and those incidents that narrowly cause accidents and hazards. And then when these employees or workers are empowered, they are most likely to collaborate in identifying and implementing safety improvements, and then they will also take responsibility for their well-being and the well-being of their colleagues. So this is the importance of empowering the workers, and we said we can empower them through regular training and provision of the necessary resources that are needed for for these safety measures. So whenever they receive this training and they are educated and they are in the know of the precaution they are supposed to take, then they feel empowered. They feel that they feel that self-efficacy, the belief that they can do it. So when they feel that they can do it, then they are going to participate actively in these programs because they know they have the knowledge. They know they have what it takes to effect these measures that improve workplace safety. So they will report the hazards because they can really identify them. They will participate in implementing those safety improvements, and they will also make sure that their colleagues and them themselves take responsibility of their well-being. Then the importance of working as a team in reduction of these workplace injuries. include that when you work as a team, there is enhanced communication and collaboration among team members, because if a member of that team in a workplace is not around, then the communication or the information that is supposed to be shared as far as safety is concerned is effectively it reaches them effectively because other team members are around. Then increased awareness of these safety hazards and improved problem solving and decision making, because as a team you're many heads, and like the old saying goes, two heads are better than one. So if you have many heads brainstorming about how to solve these safety issues, then there will be improved problem solving and decision making. But also, we have collective accountability in maintaining a safe work environment, because there are many people in this workplace who are working as a team. Then everyone will be accountable to another. If one does a wrong thing as far as safety in a workplace is concerned, there will be another person who is a member of the team will most likely correct them and tell them what to do. Then we have an aspect of uh, of workplace safety called proactive approach, and in this case, we are looking at measures that are put in place way before these workplace hazards occur, way before someone develops an illness or an injury due to work or to the processes in a workplace. So these proactive approaches, whenever they are developed in a workplace, they serve many roles, and they have numerous advantages, including prevention of workplace incidents and injuries. Yeah. So if you put in place these proactive measures, or those measures that are put in place even before these workplace injuries occur, then prevention of these workplace incidents will be achieved. If you have those fire extinguishers even before the fires take place, if you have personal protective equipment even before those injuries and illnesses occur, then you'll have prevented those workplace incidents and injuries. And then there will also be early identification and mitigation of potential hazards. Yeah, because you have put in place those systems which detect uh, those hazards, and then improved employee morale and satisfaction. Employees feel a lot of enthusiasm to work because they know their health is protected. And then reduction in workers' compensation costs and lost productivity, because these measures will prevent those illnesses. Then you will not have to compensate the workers because they will not even have those injuries or illnesses. Then enhanced reputation and credibility for the organization, an organization that proactively puts in place measures to protect its workers way before they even develop any illness, has that reputation and credibility from the society and other organizations. So it is very, very important to proactively put in place measures that protect occupational health and prevent these illnesses and injuries before they take place in the workplace. Then the management or the leadership of any organization also has roles to play as far as workplace safety is concerned, and these include developing and communicating a clear policy and program on safety, and then providing adequate resources for safety initiatives. And like we said, these resources will help to empower the employees and also will help in mitigating some of these safety issues that can arise in a workplace. But also, management should do regular safety training and education for employees. Again, this training will empower the employees. They will feel uh, that self-efficacy that they can take part in these safety initiatives. So this regular training should always be done by the management. It should facilitate the people who do this training on workplace hazards and how to prevent them. Then establishing mechanisms for reporting and investigating safety incidents is also a very, very vital role of the management. So the management should be in position to put in place those mechanisms that encourage employees to report these safety incidents whenever there is a fire that maybe was caused by a worker who did it carelessly. Then there should be someone to report such an incident, and maybe that worker can be guided on prevention of future fires. And then management is also concerned with encouraging employee participation in safety committees and decision making. So, whenever you're putting in place these safety measures, management is supposed to ensure that employees participate in in planning and implementing these safety measures, because the employees are the ones who are most affected by these safety issues. So they know how things happen, and they always have that feel of what should be done. So they should not be sidelined whenever these safety committees are convening and these safety measures are being put in place. Then it is also a role of the management to continuously evaluate the safety practices and procedures that were put in place to see if they are working, and if they are not, identify those gaps and put in place mechanisms to improve those areas which need improvement. So the illnesses and uh, and injuries that we are going to look at in this session, one of them includes these ergonomic chal- challenges. Yeah, so these ergonomic challenges arise from poor arrangement of equipment in the workplace in such a way that the employees end up getting some of these challenges. Yeah, so if you can imagine a workplace in which chairs do not offer employees good posture, like you have these chairs in which when a person sits, they are going to get these musculoskeletal disorders like back pain, neck strain. The monitor, the way it is positioned, the computer monitor is poorly positioned, and someone will always strain their neck to look at it. So all these are ergonomic challenges in the workplace. You can also think about people who do construction and have to lift a lot of weights. Instead of using pulley systems to maybe transfer these weights to a higher level, they are they are manually lifted by people. So all those are ergonomic challenges which can lead to various injuries and illnesses among the workers in various workplaces. So the major issues that are associated with these poor ergonomic designs include those musculoskeletal disorders like back pain, neck strain. Then we have reduced productivity and efficiency. If someone has a lot of back pain, then their productivity reduces inevitably. Then sometimes it might be too much for them and they'll be absent from work. And when they are absent, they are most likely to go to the health facility to seek for medical attention, which will involve those healthcare costs. And then bearing in mind that there is ergonomic challenges, lifting, poor positioning of these monitors and keyboards for those workers who work with computers will decrease the employee morale or enthusiasm to come to work. And that means that they will not be satisfied with the job. And of course, if there are these ergonomic challenges, then the risk of injuries and accidents increase. The good news is that we have simple solutions to these ergonomic challenges, which will include adjusting workplace ergonomics or the arrangement of equipment in the workplace, which will include chair height, monitor position. We are talking about the computer monitor here. The keyboard placement, is it placed in a way that does not strain someone's hands? The monitor, is it in a position that does not make a person end up getting neck strain? So whenever these things that we are talking about, the chair, the monitor, the keyboard, whenever they are in good positions, then you can achieve uh, improved ergonomics or workstation ergonomics. So the other solution is providing ergonomic tools and equipment. Make sure that, like we said, these keyboards are properly placed. You have adjustable desks so that whenever you feel back pain, then you're able to adjust your desks. Supportive chairs to support the back so that you can prevent that back pain, but also encourage regular breaks and stretching exercises. Also promote proper lifting techniques, like I said, using pulleys instead of manually lifting heavy weights. Then offering ergonomic training and education for employees. Employees should be aware of the proper ergonomic strategies so that they do not end up with these challenges. So the role of leaders again, the role of managers, employers, human resource personnel, or even us public health professionals in workplaces, is to set a positive example by practicing those good ergonomic habits. It is more likely that these employees or your fellow workmates are going to follow what you are doing. So you are if your keyboard is placed in an improper way, then your fellow employees will end up also practicing what you are doing, and this will not be good. Then also you realize that another role of leaders is to provide the resources that can support these ergonomic improvements. So you want to make sure that the resources such as those adjustable desks, those back supporting chairs are in place so as to achieve these ergonomic improvements. So it is the role of these leaders to provide them. Then you make sure that you communicate why good ergonomics are important to these employees, because some of them are not aware. So if you don't have the knowledge, make sure that you bring in ergonomic experts to educate these employees about the importance of sitting well, observing a good posture, uh, not weight, not lifting a lot of weight. All these ergonomics or the proper arrangement of elements of a system in a workplace should be communicated in a proper way to employees so that they can really perform good ergonomic practices. Then the other role is to encourage employee participation and feedback in ergonomic issues. So there should be a system of communication in which employees freely participate to give this feedback about ergonomics in a workplace. Then incorporating these ergonomic considerations in work processes and job design, even before you set up an office, there should be these ergonomic considerations that are put in place. Yeah, whenever you are designing how your office is going to be set up or your industry, these ergonomic considerations should be at the back of your mind so that you do not end up having those ergonomic challenges. So we can address these challenges on different scales, and they can be addressed on small scale level, whereby you do individual workstation assessments and adjustments. So you focus on those individual workstations which are having those ergonomic challenges, or where these equipment and and elements in an office are not arranged in a proper way. Then you can also train these employees on the principles of ergonomics and good practices, observing good posture, making sure that you place your hands very well whenever you are typing, proper placement of the keyboard, to prevent that those musculoskeletal disorders. Then we have encouraging employees to report ergonomic concerns and providing prompt solutions to those concerns. So at small scale level, those are the solutions that you can put in place. But at large scale level or the entire system, if you are focusing on many workplaces, then as an occupational health professional, you can implement ergonomic policies that and guidelines that will be followed by these workplaces. Okay, if you are maybe working as an occupational health safety officer at district level, then you need to make sure that the district in which you're operating has workplaces that follow these policies and guidelines that you have implemented. Then you need to conduct comprehensive ergonomic assessments of workplaces. Yeah, you do this by going to inspect these workplaces and making sure that they are adhering to these policies and guidelines. If they are not, you also identify why they are not. The limitations, is it because they do not have enough resources, or is it because they are not aware, or are they stubborn not to put in place these ergonomic adjustments? Then collaborate with ergonomic experts and consultants to provide the necessary information as far as these ergonomic uh, challenges are concerned, and how to improve the ergonomics in workplaces. Then integrating ergonomic considerations into facility design and equipment selection. Like I said, even before you put in place a workplace, or you set up your workplace, these ergonomic considerations should be put in place. Okay, the equipment that you're selecting should be ergonomic friendly. It should not be that equipment that promotes back pain. Then if you have put in place all this, you should monitor and evaluate if those interventions are working, and if they are not, you make sure that you put in place corrective measures to make them work or to improve those areas that need to be improved. Then the other aspect of workplace injuries and illnesses that we need to look at is stress. Yeah, so this stress or that feeling of hopelessness, that feeling of being in a low mood, you know, being worthless, you know, all this comprises of stress in the workplace, and it can lead to various problems which will affect the workers and their functionality. So these this stress that we are looking at here, it can it can be of detrimental effect to both the workers and the organization in which they work. So the general issues that can result from this stress will include increased absenteeism and turnover rates. And when we talk about turnover rates, we are looking at the frequency at which these employees or workers are leaving a certain organization. So if they are stressed, they are more likely to be absent or even leave the workplace altogether. But also, there will be that decreased job satisfaction and morale or the enthusiasm to work because of being stressed. Then we have reduced productivity and performance. Because of this stress, they are not able to produce like they have been doing, or their work rate will go down. And then work related conflicts and communication breakdowns because of this stress. Yeah. And then adverse effects on the physical and mental health of workers. Workers who are stressed might end up getting these mental illnesses. Their mental functioning or the functioning of their brain will not be as that of those who are not stressed. But also, stress is known to cause physical health disruption. Yeah, there are some hormones that are released whenever you're stressed, which could lead to some non-communicable diseases like hypertension, and other diseases which can be detrimental to one's health. So stress is never a good thing to take pride in, and in a workplace there should be measures that are in place even before people are stressed to handle these stress incidences. So the effect of stress on worker productivity itself, here we are looking at the general effects on the organization and even the workers, but we want to focus on the worker productivity, whereby stress is known to decrease the concentration and focus on tasks because your head is not, you're not thinking straight. Okay, then you are not able to concentrate and focus on the tasks that you have to perform as a worker. Then if you are not focused, of course your decision making abilities will also be impaired or they will be weak. Then if you are stressed, you cannot focus, you cannot concentrate on anything, you are not thinking straight because of all these that have impaired your thinking ability, and because of you not having that right mental state, then you cannot be creative and innovative in the workplace, which will not be a good thing as an employee or as a person who needs to produce results. But also, you can create accidents and errors in a workplace, okay? Because you are not really focused on what you are doing because of this stress. Then poor time management and increased procrastination. And in increased procrastination, we are talking about that act of postponing those tasks, something that you are supposed to do today. You keep on saying maybe tomorrow. Tomorrow comes, you also said the other day. So all that can be effect of stress, and it will impact negatively on the worker productivity. So there is always need for stress counseling programs, like I said, and these offer various interventions, including individual counseling sessions whereby one person can go in at a go to address those specific stressors and develop coping mechanisms or mechanisms to deal with that stress. Then at organization level, we can always have those workshops and trainings sessions to manage stress. So these will have all of you in the workplace, all workers coming together and engaging in these stress management techniques. Then there is also employee assistance programs that provide confidential counseling and support services. Then wellness initiatives which promote the balance between work and that life that is besides work, and this will help to reduce stress. So any person, any worker needs to have that balance between work and that life outside work. So whenever there is that imbalance, then there is always uh, likelihood of developing stress, because you need to attend to your family. You need that time for yourself, that me time that we are talking about. So you need to make sure that you balance that work and then life outside work. So if there is that imbalance, then you can end up getting stressed. So we acknowledge that for us to study stress more, we need to bring in the aspect of epidemiology, which will examine the distribution, the determinants, and the impact of stress in the workplace. So whenever we bring in epidemiology, we want to study the prevalence or the total cases of stress in the workplace. We want to look at the risk factors or what could predispose someone to this stress, and then what could be the likely health outcome of being stressed. So in prevalence, we acknowledge that there are high stress levels in various occupations and industries. Yeah, you cannot say that uh, stress is localized in one particular place. You cannot say that casual workers are the only people who are having stress. We also know that people in those white collar jobs who are in those formal employment uh, workstations also suffer from this stress. Okay, so you cannot say that it is localized in one particular occupation or an industry. Then we also acknowledge that there are risk factors which could predispose people to stress, and these include high job demands, low control over work, inadequate social support from the people around you, either the fellow employees, uh, your employer, the family, the community. That imbalance between work and life after work all contribute to increased stress levels. And when there is a lot of stress, you might end up getting those physical and mental health problems, including cardiovascular diseases like hypertension, musculoskeletal disorders, anxiety, and depression. So apart from stress, we also have what we call impairment, or that reduced functionality of an employee in the workplace. It could be due to addiction, it could be due to an injury or any illness that will impair the functioning of a worker. So the costs that are associated with this impairment include decreased productivity and quality of work. Person cannot uh, produce the quality of work as they used to because of this impairment. or because of this reduced functionality, which could arise due to a disease, an illness, an injury, or addictions. Okay, then there will also be increased absenteeism or and presenteeism. So absenteeism is that act of not coming to work, but presenteeism is a case where the worker comes to work, but they are doing nothing at work. So they are just present physically, but they are doing nothing. And then we have higher rates of accidents and injuries. So if a person is not functioning normally or they are impaired, then there are higher rates of accidents. You can think of a person who needs two arms to lift something, but now one arm is not working because it is injured and they are not given a day off. So if they use only one hand to lift the same thing that is supposed to be lifted by two hands, then there are those higher rates of accidents and injuries to even this one arm that is functioning. Then we have increased healthcare and insurance expenses because uh, due, since we have talked about these accidents and injuries, then you expect that if they increase, then the healthcare expenses also increase. Then, if someone is impaired and they are working in a team, then that means that there will be that negative impact on the team dynamics. A team which was producing good results might not produce the same good results because of that impairment of one member of the team. Then, the other aspect of illness and injuries in a workplace is addiction, which is more of a chronic disease that is characterized by compulsive drug or alcohol use despite the negative consequences. So people who are addicted continually use these drugs, alcohol, or anything that has negative consequences, but they do not stop. They continue to use the same thing even when there is recognized negative consequence. So it is a complex condition that will require management and support rather than one time cure. So you do not expect to cure or stop this addiction using a one-time measure, but you need this ongoing management and support. And its effects include decreased performance on your job and reliability. Sometimes these people use these drugs and alcohol and end up being absent from work, or whenever they come, they are always late, which we have called frequent tardiness or coming late to work, or sometimes delivering their tasks late, okay, which we have also called tardiness. Then, because of this addiction and this compulsive drug use, they might end up causing accidents and errors. Then we also have poor decision making and impaired judgment. Yeah, because these drugs impair the functioning of someone's brain. So they will make those poor decisions, and even judgment on whether to do to do something or not to do it will also be impaired. Then there will be increased conflicts and strained relationships with co-workers, especially when the addiction in question is alcohol. Yeah, because it impairs someone's judgment and sometimes their brain function. Then they are more likely to be involved in these conflicts with fellow workers, and these conflicts will lead to those strained relationships with their colleagues. Another injury that we need to interest ourselves is vision and hearing injuries, and these can be prevented by taking appropriate precautions, including wearing appropriate eye protection, putting in place engineering controls to reduce noise levels, to protect the hearing function, and then conducting regular inspections and maintenance of equipment to prevent hazards. And when we talk about maintenance of equipment here, we are especially looking at the hearing function. For you to protect the ears, sometimes you need to maintain your equipment in good function so that it does not produce that noise that comes whenever that equipment is getting old or is not properly maintained. Then you also need to provide training and education on proper use of this protective equipment that will prevent these vision and hearing injuries. So the products that can be used to protect vision include safety glasses, goggles, face shields, welding, helmets, and protective screens and barriers. So all these prevent any particle from reaching your eyes or heavy light from damaging your eyes. And they should be in places where your eyes are always at a risk of being injured by anything that can either get in contact with your eyes or damage your eye tissue. Then for hearing, we have earplugs, which are always fixed inside the ears, and then earmuffs and noise cancelling headphones are almost the same. They look like these music playing headphones and are placed around your external ears to prevent too much noise. And then custom fit hearing protection that can also be used to protect one's ears from noise pollution. Yeah, so those are some of the injuries that we can encounter in the workplace and the protective measures that can be put in place to avert some of the injuries and illnesses. So we realize that industries and companies have a role to play in protecting their workers and employees from these injuries and illnesses. And some of their responsibilities include conducting workplace assessments to identify potential hazards or these conditions that can lead to injuries and illnesses, and then putting in place engineering controls and administrative measures. Like we said, engineering controls will include like proper ventilation to prevent air pollution. You know, administrative measures can include rotational work and using shifts to prevent and reduce exposure to those toxic elements of work. And then we also have providing necessary PPE, like we looked at in hearing and vision protection, and then training employees on the use and maintenance of protective equipment. Yeah. Apart from providing this PPE, the workers need to be trained on how to use it and maintain it, and then regular evaluation and updating of these practices that promote safety, so that you can identify the gaps that need to be filled. Another key aspect in a workplace, in any workplace, is that workplace emergency and disaster planning, because it plays a very critical role in ensuring that there is preparedness, response, and recovery during emergencies and disasters. And its key responsibility is to develop and maintain an emergency response plan. There should be a plan on what is going to be done whenever there is an emergency, whenever there is a fire, whenever there is an accident in a workplace. There should be a plan that is in place even before this happens. Okay, so this team that puts in place this team also goes on to conduct risk assessments or those things that can lead to these potential hazards occurring, and then establishing communication protocols and emergency notification systems. There should also be those communication protocols. Who is going to receive the signal first whenever there is this emergency? How is it going to be received? Okay, are there those alarms that can detect fire or smoke in a workplace, so that an alarm is sounded and every employee is able to evacuate the workplace in order not to be uh, to be gutted in that fire. Okay, so there should be those communication protocols and emergency notification systems, and this is the responsibility of this workplace emergency and disaster planning team. Then the other responsibilities of that team is to train employees on how to be prepared for these emergencies and where to go in case of the emergencies occur, evacuation plans, how they are going to be taken out of a building or a workplace in order to prevent them from being consumed by those emergencies in the workplace. But also, the team needs to coordinate with local authorities and emergency services like those fire fire brigades who put off the fire in case it occurs, the local authorities who are going to provide security whenever there is an emergency. Okay, the team is also concerned, or this emergency team is concerned with providing those drills, exercises, and evaluations to test these preparedness. So there should be regular drills and exercises to ensure that everyone in this workplace is aware of how to manage an emergency, what to do in case an emergency occurs in that workplace, and evaluate if they have learned one or two things as far as these emergency management techniques are concerned. So the value of all this management in the workplace, or this emergency management in the workplace, includes rapid response and effective coordination during crisis. If there is this management plan in if there is this emergency management plan in any workplace, then you can be sure that there will be this rapid response and effective coordination whenever a crisis arises, whenever a fire, whenever there is a fire outbreak, whenever there is any any emergency in that workplace, there will be this rapid response because there is a plan. If there is this rapid response, then you are able to minimize injuries, fatalities, or deaths and property damage because there is this plan to effectively control whatever happens in that workplace. Then there will be continuity of operations and reduced downtime because there is a plan to avert all these fires, all these emergencies. Then the downtime, or that time in which there will not be work, or in which the industry will not be working, which we are calling the downtime, will be reduced. Okay, so if it is reduced, then the operation will be continuing. And then enhanced employee confidence. Employees are able to feel confident and enthusiastic about working because they know that there is a plan to protect them whenever there is an emergency. And then compliancy with legal and regulatory requirements. These plans are always required by these occupational health uh, institutions. Okay, any workplace should be having these plans. So whenever it is in place, then you are able to comply with these legal and regulatory requirements. Even if an injury happens to an employee, and maybe their lawyer comes to investigate what happened. Whenever you have a plan in place, you are able to spend less than than the organization that does not have that plan. Okay, because at least they see that there was this compliance with those legal requirements. Okay, so this is why it is of a lot of value to have this workplace emergency management plan. The other aspect that we need to talk about in a workplace is bioterrorism, and Centers for Disease Control and Prevention defines this as the intentional release of biological agents like bacteria, viruses, and other germs that can cause sickness or kill people. So causes this poses a unique threat that requires specific preparedness measures in the workplace. So you've heard stories of where people in a workplace open a parcel expecting a letter, and yet that parcel contains like a bacteria like anthrax. So you open a parcel, and instead of getting a letter, you end up getting these biological agents that cause disease and can go on to kill you. So this is what we call bioterrorism. It is an intentional release of these biological agents. It is not accidental. You do not get this bacteria accidentally, but someone or another competitor in the industry can can intentionally release or give to you this biological agent, and it can either kill or make you sick. So we need to be prepared for this bioterrorism in the workplace because of its impact on public health, safety, and organizational functioning. Whenever, of course, people are sick, the organizational function will also be impaired. Then we need to protect employees and mitigate the spread of infectious diseases. That's why we need to prepare for bioterrorism in the workplace. But also, it is a requirement by public health agencies and law enforcement to be prepared for bioterrorism. So, whenever we are prepared in a workplace, or whenever we put in place bioterrorism preparation plans, then we are able to collaborate with these public health agencies and law enforcement. So, developing this bioterrorism response plan involves a few steps, including risk assessment. You identify the potential bioterrorism threats, the people who are vulnerable, and then the consequences of such bioterrorism threats. Yeah, so you are supposed to be identify those areas that can be potential bioterrorism targets. Those people who receive letters, like I said, the secretaries, okay, the receptionists who can be able to transmit these threats to other people in the organization. Okay, so yeah, you're supposed to identify the threats, the people who are vulnerable, and then the consequences. Then you're supposed to also put in place uh, those planning and resource allocation, develop those strategies, guidelines and protocols and procedures to go around with this bioterrorism response. Okay, then communicate and notify, establishes mechanisms for rapid communication and employee notification during a bioterrorism event. There should be those communication protocols. Not everyone should be able to make an announcement of a bioterrorism in in a workplace, but there should be someone who communicates this bioterrorism threat and then puts in and guides the workplace on what is going to be done. Then the other step is to train and conduct drills to ensure that the employees are familiar with bioterrorism response procedures. What should be done whenever there is this bioterrorism uh, threat or attack on a particular workplace. what is going to be done in order to control the spread of this infection. Okay, then whenever you're doing these drills, you can be able to evaluate whether people are learning on how to avert these bioterrorism attacks, and then you identify gaps in which you need to improve so that your response plan is able to achieve uh, a version of this bioterrorism threat or attack. Okay, so it is a unique kind of kind of 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 problem in workplaces, but it should also not be underestimated because it can cause loss of lives, can cause impairment, and of course reduced functioning in the organization. So that's why we need to make sure that this bioterrorism is dealt in a quick and prompt fashion. Then the other aspect in workplace safety is workplace wellness and health promotion programs. And here we are looking at initiatives that aim to improve the health and well-being of employees. And in this case, we look at the value of workplace wellness programs, which include improved employee health outcomes. Whenever we have these wellness and health promotion programs, they could be on physical activity, they could be uh, on uh, on sexual health, they could be on regular check and routine health checkups, so they are able to improve employee health outcomes, increase productivity and job satisfaction, and reduced healthcare costs and absenteeism, enhanced employee morale or the enthusiasm to do work, and they are able to prevent chronic diseases and promote healthy lifestyles. Like I said, if you have physical activity wellness programs, then chronic diseases like hypertension, diabetes due to obesity can be prevented. So the behaviors that are responsible for worker illness and injury, which should be a target by any health professional or any public health professional so that you can prevent these injuries and illnesses, include sedentary lifestyle and lack of physical activity. People who sit for long in offices, you know, and lack this physical activity will end up getting some of these chronic illnesses. Okay, and then poor nutrition and unhealthy eating habits can lead to obesity and then other other ills that can arise from obesity, like diabetes type 2, and then tobacco and alcohol use that can cause addiction, and we saw the effects. Okay, then inadequate stress management and sleep deprivation. Sleep deprivation has an effect on your mental functioning, but can also go on to cause stress. Okay, so inadequate stress management and sleep deprivation are very, very, uh, very detrimental to your health as a worker. And then lack of safety precautions and non-compliance with safety protocols. If there are no personal protective equipment, or if they are in place but you are not utilizing them, then you can end up getting these injuries and illnesses from your workplace. So developing a workplace health promotion program will include assessment to identify the needs, the interests, and the health risks. And this can be done through surveys, health screening, and data analysis. Like we said in our first session, as an occupational safety and health professional, you should be able to be the custodian of the medical forms of these workers. So from these medical forms, you are able to identify the needs. What are most people what are most workers suffering from, okay? Then that can project you to the needs of these people. If they are suffering from sexually transmitted diseases, then you can look at tailoring your health promotion program to address those sexually transmitted diseases. Do they need condoms in the workplace? Do they need to be do they need other sexual other prevention measures in terms of sexual health? Okay, if they are suffering from from uh, from diseases that arise due to air pollution, are we protecting them properly using this personal protective equipment? Okay, so this is the essence of conducting this assessment. Then from assessment, you need to plan, set your goals, objectives, and strategies based on the assessment results. Here you develop an action plan and establish what will comprise of your program to promote health in your workplace. Then you implement or execute the program by engaging all the employees, providing the necessary resources, and conducting health education and offering interventions. Then you evaluate the the success of your program. You assess the outcomes, satisfaction by the workers, and the program impact. Then you can always continually improve through by making the adjustments that are needed and refining the strategies if they are not working very well. Then you put in place better strategies and enhance the program's effectiveness over time. Then in wellness and health promotion, we need to also acknowledge that workers' nutrition and physical activity are of paramount importance, and programs focused on improving these workers' physical activity and nutrition are of significant value because they improve their overall health and reduce the risk of chronic diseases. Like we said, these diseases that can arise from poor nutrition and inadequate physical activity will include obesity and diabetes 2 or diabetes type 2, and then cardiovascular conditions like hypertension. Then we have increased energy levels as a result of proper nutrition, which will improve the stamina of an employee or a worker, and then their mental well being. Because you realize that when you do not feel well, then your mental well being will also be compromised. Okay, so all this will lead to improved productivity and job performance. Then the other effects or the other importances of worker nutrition and physical activity is enhanced workplace culture and comradeship through shared health, healthy activities and goals. So if you have your workers in an organization taking part in in physical activity drills every evening. This, of course, improves the workplace culture and comradeship among the workers. And if they do that, if they are able to connect with each other through uh, health, these physical activity drills, then there will be that shared those shared goals and improve comradeship. They feel they belong with each other and they feel like they are working with each other, and that workplace culture will be able to improve the productivity of these employees and the overall development of that organization. But also from this proper nutrition and physical activity, you reduce healthcare costs and then in the long term impact positively on the employees' lives, their families, and the communities. because they are able to take this information and this culture outside, even the workplace, to their families, to their communities, which will be a long time positive impact. So, lastly, we need to look at evaluation of workplace injury or illness prevention. So, all these measures that we have looked at, we need to look at how effective they are. So, we do that by evaluating these prevention measures. And we have majorly three evaluation techniques. And the first one is economic evaluation, which assesses the costs and benefits of workplace illness prevention efforts. And the benefits of this evaluation or economic evaluation include the fact that it demonstrates the value and impact of prevention programs, and then it guides resource allocation and decision making, but also it helps in identifying the cost effective strategies for improving occupational health because it attaches that economic value on its strategy. Okay, and then the benefit of the strategy. Then it provides the evidence for policy advocacy and program sustainability. Before policies are put in place, there is always that economic value that is always assessed. So when you conduct this economic evaluation, then you're able to guide policy and also provide evidence for program sustainability. Then the second evaluation technique is to use years of potential life lost, or what we call YPLL. So this YPLL is a measure that is used to assess the impact of premature mortality due to these illnesses and injuries in a workplace. So it represents the number of years that are lost due to premature death caused by these injuries and illnesses before reaching a certain age, and often it is standardized the reference age of 65. So this will help to quantify the burden of the workplace injury and illness in terms of years of life that are cut short. So you look at an injury like an illness like stress. So instead of someone dying at 65, if they are stressed and maybe they die at 60, then the other person dies at 62, the other person dies at 61. So you look at that average of the age that they are dying at, and then you see the difference between the standardized age, which is 65, and that average. So you're able to find out the years of potential life lost due to stress. Also compare it to another illness, and you see the years of potential life lost, and then you're able to look at which illness requires more attention, that causes more years of potential life lost will need obviously to be of greater priority to you or your intervention measures. Then the last evaluation technique is the and cost to benefit analysis, which evaluates the economic feasibility and efficiency of workplace prevention efforts. So the critical aspects of cost benefit analysis include assessing the costs of the intervention, and here you're looking at the implementation costs, the training costs of the employees, the healthcare costs, and then you also quantify the monetary value of health outcomes if they are if these prevention measures are put in place. Are you able to gain in productivity? Are you able to reduce healthcare expenses? And you also quantify them and attach a monetary uh, value on them. Then you compare the costs and benefits to determine if the intervention is economically justified. Because ideally, you should make sure that the benefits of any intervention outweigh the costs. Okay. Yeah, so the productivity gains of your intervention, the reduced healthcare expenses should be very, very uh, economically justified, or they should outweigh the costs of this training, the implementation costs, okay? And all this will inform decision making by considering both monetary and non monetary factors. So, all this will help you to evaluate on which workplace illness prevention strategies should be put in place to effectively prevent and manage these illnesses and injuries that arise from the workplace. So, this is all that we have today, and I thank you so much for joining me in assessing workplace injuries, where we looked at the different injuries and illnesses that we can find in our workplaces, their effects, the preventive strategies that we can put in place, and the roles of different stakeholders, especially the leaders in the workplace. But also, we were able to look at the role of emergency and disaster management teams, and also evaluated the effectiveness of these prevention strategies. So, thank you so much again for joining me in this session, and I shall see you on the next one. Have a good day.